Hi there, thanks for attending this webinar on the Colorado Framework. The goal of the webinar today is to discuss what we mean in the state of Colorado when we start talking about integrated behavioral health and primary care. There needs to be an underlying understanding of what we conceptualize as integrated care and how the state can begin to move forward looking at how to comprehensively integrate behavioral health with primary care. First, let's start with some working assumptions here. This definition of integration is taken from the Agency for Healthcare Research and Quality's Lexicon for Integrating Behavioral Health and Primary Care, a seminal document that we will be using repeatedly today as a way to best classify what we mean around integration. The definition of integration from the lexicon is as follows: the care that results from a practice team of primary care and behavioral health clinicians working together with patients and families using a systematic, cost-effective approach to provide patient-centered care for a defined population. This care may address mental health, substance use conditions, health behaviors including their contribution to chronic medical illnesses, life stressors and crises, stress-related physical symptoms, ineffective patterns of healthcare utilization. The value of integration and why the state is moving towards this model within the State Innovation Model Grant is that physical and behavioral health integration is good health policy and good for health. Defragmenting care really leads us to a place that we want to integrate care. As I mentioned, everything that I will be discussing from this point forward is found in the lexicon document that can be found at the web address there on the top of your screen. So let's start with the three defining components of integration, and I'll go into detail on each one of these in just a second. We start with teams, shared patients and mission, and systems to support integration. There are supporting components within each one of those elements that really makes the practice start to think about how they can create the operational infrastructure necessary to be integrated. First of all, reliable operations and processes, having alignment of purpose and leadership, having continuous quality improvement and outcomes monitoring, looking for a sustainable business model that supports the integration, and then at the heart of it all, what the community expects for their care. We've proposed using these three scopes as a way to better understand the infrastructure necessary to integrate care. Beginning on the left with Scope 1, we anticipate that practices will need to enhance their capacity as they move forward with more robust integration. The defining components seen at the bottom are really a part of each one of these scopes. And as you'll see here in just a second, we believe that this is a cumulative process. Starting by integrating in Scope 1 and moving to Scope 3 really is a mutually beneficial process for the practice as they start to expand the type of patients, the type of processes, the type of efforts that they undertake for integration. There are expectations within each scope. This is a population-based model. This is not about just individuals and not just about diseases. This is about looking at the population across the lifespan, acute, chronic, and prevention, and then having thresholds of operational performance that really require practices to start to achieve certain levels of functionality so that the integration is most successful. As I mentioned, the cumulative piece here is that within each scope there are various aspects of the infrastructure that may grow or expand as the practice matures around their integrated effort. Back to the defining components for a second. Let's unpack these. So starting with teams, it's recognized that the role of the behavioral health provider will not only just be able to assess and identify behavioral health needs of the population, but also to provide the appropriate interventions, to coordinate care when appropriate, and to follow up and monitor outcomes, to look at ways to support the family and the community, and to provide crisis interventions. The shared operations and workflows and the culture change, all of this is really inherent within practice change. But the ability to enhance the communication and the coordination between the team, behavioral health and primary care, between the team and the family and the patient, and then being able to reliably execute some type of systematic approach to the elements of care. And then, of course, education and training. Key staff must be prepared to carry out what looks to be a new model of care delivery and to recognize their roles and responsibilities within the team. How can that team work together collaboratively for the betterment of the patient? Looking at the shared patients and mission, Having a shared panel of patients means that the team is responsible for total health outcomes, including behavioral and physical. That the patient experiences the practice as the place that they can come for all their comprehensive primary care, including behavioral health. And the practice feels that it is their responsibility to then offer behavioral health within the primary care setting. And then finally, having a systematic or clinical approach to care. How do you routinely identify patients that are going to have their needs met by the primary care and behavioral health team? How do you engage the family around that treatment? How do you have a unified and shared treatment plan that works for both the behavioral health and the primary care provider? Central to that seems to be the need to have a shared electronic record. And then, of course, systematic follow-up and adjustments to care that will become appropriate over time as the practice matures and can follow patients and adjust their care according to some of the data that they're collecting. The end goal here is that the patient is at the center of a comprehensive primary care world that has behavioral health providers integrated into it. The goal for today's webinar was to be able to offer you an overview of what we are looking for within a comprehensive integrated behavioral health and primary care setting. Grounded in the lexicon, as you can see here in the link, this model really does allow us to have parameters around what we mean when we say integrated care. You can find out more information on the coloradosym.org website, or if you have additional questions, you can contact us at the email below. Thank you.